choose to work in healthcare, and how did you know it was the right path for you?
I think from an early age, I just wanted to help people.
I really enjoyed science growing up. I've been on teams throughout my whole life with sports. I've always enjoyed helping others.
For me, physical therapy was something I saw a family go through.
I chose to work in healthcare because I've always liked working with people. I've always liked helping people. It's what made me fall in love with healthcare. And I knew it was the right path for me because I feel fulfilled by doing what I do. It doesn't always feel like work, and I enjoy it.
As a high school student, I worked in a nursing home as a nursing assistant, which also focuses on helping people with their everyday life skills.
I was an undergrad. I did shadowing at the VA, volunteering and working in the PT clinic. And then I was like, that just cinched it for me. I was like, I really like this.
I also really enjoy the team aspect of physical therapy, especially in the hospital setting.
I got to go to all of my mom's therapy appointments, and I really just fell in love with how they were helping her get back to her daily life.
What tasks do you have as someone in this role? I'm transitioning someone. They were upstairs in acute care, and we're trying to get them prepped and ready so that they can go home. So we're working a lot on their ability to get in and out of bed, walking or using a wheelchair, whichever level they're going to be at.
In the outpatient rehab department, I work with folks who recently had a stroke or a traumatic brain injury or a spinal cord injury. They come in for an evaluation, make priorities based on those goals and those limitations that they're having, and we work toward those goals to help train them how to best support the patients in their recovery.
My role is to carry out the physical therapy plan of care that's been created by the physical therapist. It looks like helping people relearn all their functional mobility, so how to walk, how to negotiate stairs, how to transfer from surface to surface. And then we also do a lot of education with the patient and as well as family members and caregivers.
What's something surprising about your job that most people wouldn't know?
We have a challenge as occupational therapists. People don't really understand what occupational therapy means, as it's defined in occupational therapy as anything that occupies your day.
So we do have a pool here, and from time to time I will get patients in the pool and do a little bit of aquatic therapy.
I would say the variety of patients that you can get as a physical therapist. I think a lot of people first think of, oh, you're in a clinic, someone just had a sports injury, but you can be a specialist in pediatrics, you could specialize in older adults, you could specialize in women's health, you could do the sports route, or what I did, I specialized in neurologic physical therapy, so I see everyone with neurologic conditions.
There is a lot of things you have to do outside of seeing a patient. So there's a lot of paperwork, there's a lot of talking with other therapists, a lot of talking to doctors about the patient's care. It's a lot of kind of management behind the scenes that you might not see just besides one-on-one with a patient.
How much strength you have to have. It does partake in a lot of lifting of people and equipment.
Part of the team aspect of how well speech therapy, occupational therapy, and physical therapy work together was something that I didn't really know 100% before I came into the role.
What is the most rewarding part of your role?
I would say just helping people get back to themselves. A lot of times in a hospital setting, we're seeing some of the patients at some of the lowest moments of their life, and being able to provide them some hope, whether it's like the first time they move their legs after a stroke or brain injury.
So I really get to bond with my patients. I get to cheer them on when they're making those great strides in their recovery, and that's really rewarding to me.
We get patients for a short amount of time, but they get a lot of therapy each day. So a lot of times they make a great deal of progress in the short time that they're with us, and that makes this job super, super satisfying.
I think rewarding is that's why a lot of us therapists do what we do. We can help people move again, we get people to walk again.
What classes in high school should you take to better your knowledge before college?
Make sure you pay attention in science.
I would also say anatomy, if you're able to have an anatomy course.
So I think the primary ones from high school was like biology and chemistry.
Almost of equal importance, or maybe even more, is psychology. So I think that's a really important piece of going into any healthcare profession. Really is not just knowing about how the body works, but how the mind works, how we're motivated. What is the best undergraduate major for someone who wants to become an occupational therapist? It's hard to answer this question because there's a lot of potential options. When you're
applying to occupational therapy schools, sometimes it's useful to have a degree that kind of sets you apart from some of the other applicants. So a lot of applicants have degrees in biology, but not as many focusing on psychology.
I graduated with biology pre-med as my undergraduate degree. Most of the students that I personally have had after I've become a physical therapist have had undergraduate degrees in kinesiology, some of them athletic training. That also provides a lot of hands-on experience that you're able to get before going to physical therapy school. Oftentimes you often have to take the GRE, which is kind of like the graduate school SATs. And so you really can do a lot of different things, whatever you're interested in for your major. But I would say most commonly people are exercise science majors, biology majors. Sometimes some schools have a pre-physical therapy program.
This one's a fun one. I'm a microbiologist, actually. Micro and chemistry were my undergrad. All you have to do is do the prereqs. So you could major in whatever you wanted to in undergrad. Just do the prereqs, you're golden.
What types of patients do you usually work with, and how have you helped them accomplish their goal?
Typically, I work with a lot of stroke patients, traumatic brain injuries, from anything from car accidents to gunshots to falls. And what I've done to help them accomplish their goals is really just adhering to their care plan. You know, I'll ask a lot of patients what's most important to them and then kind of treat them accordingly.
A lot of times we're working on daily tasks with them, whether it's just being able to get out of bed or into a car or into a wheelchair. Teaching them to walk again is a huge part of the role that we do here.
I have the great pleasure of working with patients who have experienced neurological conditions. I say I have the great privilege of doing that because these people have often experienced the most trying, the most traumatic experience in their life. So I'm kind of meeting them at one of their most trying times in their lives.
Can you share a success story where the patient achieved something incredible and how it made you feel?
I think of one patient that I had. He was unfortunately texting and driving and flipped his car and ended up getting a spinal cord injury. And so he was unable to walk. But with a lot of training and strengthening and practice, we were able to get him to walk a little short distances. And he actually was able to walk across the stage for his graduation with help. So a story that comes to my mind is a young woman who was in a car accident and had a spinal cord injury when she was, I believe, a senior in high school. She was able to go to college, which was a huge success for her. I was able to take part in going to the college she's been accepted to, looking at her dorm room and making suggestions for how to modify the dorm room to best maintain her independence. Healthcare is tough, and there's a lot of things that we have to do, and there's some tough situations, but there's some ways that we can really help people achieve some amazing things.
How has working in this position changed the way you think about healthcare?
It's kind of brought to light the fact that we really need more compassionate people in this field. We need people who are going to enter this field and do whatever they can to promote the best interest of the patient.
It has changed the way I view the continuum of care. I've worked in every setting except for home health so far. And so it's kind of been interesting to see kind of the building blocks that we get in acute care to coming to rehab to transitioning to either a skilled nursing where they're continuing on from this rehab journey before going home, or that jump home and then continuing with outpatient stuff. And so it's kind of unique to see, hey, we're making this change here, but the road's not done, and kind of just that aspect of healthcare that it can keep going and keep growing.
What advice would you give someone interested in pursuing this career?
Get to know people. Like, start your research on interacting with people.
I would recommend that you get as many opportunities as you are able to see all different types of settings. And the beauty of physical therapy, I think, is that there are all types of settings with all types of different patients.
The shadow places. I went to the VA, I was doing volunteer hours, because one, that was a requirement. I had to have so many volunteer hours. But that way you get an idea of what's out there for PT and whether or not it's actually a good fit for you.
Definitely take those anatomies as soon as possible. But I would also say, make sure your heart's in the right place. If you care about people, then this is for you.
Never give up. It's going to be hard, but just don't give up on yourself.